Alrighty, we're in action now. So we're gonna start today's session by showing you a quick video. This video features a couple of our different RFWs that are currently designated and just gives you a little bit of information about what RFW is.
A recovery friendly workplace is an organization that has gone through a certification through Michigan Recovery Friendly Workplace Initiative, and they've been trained to be able to understand the needs of their employees who are in recovery or who might be seeking recovery. When you're a part of the hospitality industry, you become very used to seeing substance use disorder. It's part of the everyday life. Quite often, you had to ask yourself, what effect are we having on these people long term, and what responsibility do we have to them as individuals to better their lives? And at Mission Restaurant Group, we want everyone that works for us to be gaining something from that experience. So we really dug down a little bit deeper to try to find some initiatives and programs that we could involve ourselves in to be a better overall employer. We really like to work with employers with educating them on what substance use disorder is. So we'll start out with the training in SUD 101, if you will. I've been so pleased to be able to communicate this to new hires and watch them as they respond to that, and then open up in a comfortable space to be able to say that that is something they're struggling with. And then to find out that they make an employment decision based on the fact that we're working in that outreach program really made a difference for all of us.
Over the next probably 15 to 20 years, labor is going to be an issue in this country. We need to figure out how to get the people who aren't working.
When I first learned about the Recovery Friendly Workplace Initiative, I was very excited about it. I kind of reflected on all of the places I'd worked in the past, that for somebody that might be teetering the line of having a problem with substances and not, maybe push someone over the edge, to focus on awareness and taking away the stigma that's associated with people that do have substance use disorder. I think it's a great program.
The Recovery Friendly Workplace Initiative really appealed to us because we want to bring more people in that are hardworking and dedicated, as those people that we already had that in recovery were. So becoming a part of something that enabled us to be better at speaking to substance use disorder and using the correct language and being a safe space for those people was really what drove us.
Becoming recovery friendly, watching real life stories of people who've gone from substance issues through to now they're in a leadership position. Those are like 180-degree turnarounds that happen because they have some support around them. We have a lot of really good workers that are in recovery that work for us.
3 years ago, before I came up here, I had absolutely no desire to even get some work. It didn't matter to me anymore that I'd lost everything, or there was no hope of getting any of that back. Where even I was from last year to this year, there's just such a huge difference. I'm just beyond grateful. I'm proud of myself.
Most people that are in recovery, once they get a hold, they get a taste of the freedom and the joy and having fun again in life. It's hard to beat somebody that is kind of an underdog in mind. So most of the people that are really passionate about recovery are going to go out of their way to prove their worth.
As we grow and as this initiative grows, you'll see more employers that are jumping on because they realize the benefits of really becoming a recovery-friendly workplace by connecting and utilizing the resources that are in their backyard, and also to be able to provide sustainable future for their employees.
Wonderful. So before we continue on, I definitely want to just take a moment to make sure that we're on the same page when you see these different acronyms, because they will definitely pop up throughout our presentation. So anytime you see SUD, we're talking about substance use disorder, OUD, opioid use disorder. RFW is short for Recovery Friendly Workplace. SAMHSA is the Substance Abuse and Mental Health Services Administration, MDHHS, which is our partner, that's Michigan Department of Health and Human Services, MPHI, the organization that both Nikki and I work with, and then CDC, Center for Disease Control. In our presentation today, we're going to dive into what substance use disorder is. Many of you on this call may already know, but we just like to have a firm definition that we utilize throughout our presentations and trainings. We'll talk about the impact of SUD on the workforce, and we'll talk about the initiative. We'll share some success stories, and then make sure you leave with some next steps on how to get started. When it comes to substance use disorder, as I mentioned, you all may have heard substance use disorder before. You may even have a definition, but we like to pull this definition because we want it to be understood that substance use disorder is treatable. We treat substance use disorder just like any other chronic illness. So whether that be something like cancer or diabetes, we treat it like something that can be treated and also prevented. So this last bullet says prevention efforts and treatment approaches for SUD and OUD are generally as successful as those for other chronic diseases. So it is important to us when we're thinking about RFW to think about SUD as something that is not a moral failing. It's not a lack of willpower. It is a complex disease that requires medical treatment and ongoing support. And considering that definition, we do want to make it known that about 48.4 million U.S. individuals are living with a substance use disorder, according to data from 2024. This may be shocking to some and familiar to others, but we want to make it known that there are a lot of people in the United States that are living with substance use disorder. In addition to that note, we want to also highlight the fact that 29 million Americans with a substance use disorder were employed, and of these, 78% worked full time. So that is important for us because the recovery-friendly workplace is all about addressing needs in the workplace. And we know that people work. People who have an SUD do work. At the bottom here, this is 2.7 trillion were lost in 2023 due to costs associated with substance use disorder. And so that is why the Recovery Friendly Workplace Initiative is important. Substance use disorder impacts people, people work, and we can use the Recovery Friendly Workplace as an opportunity to assist and address and provide resources and support to people who are already at work. Just to give you a little bit more in depth about how substance use disorder shows up based on occupation, we have this table here, and you can see kind of at the top, there's education, health, and related occupations. And then at the very bottom, there's the construction trade. So you can note that in the construction trade, there is a higher prevalence of people who have a substance use disorder, but it doesn't just affect people that are in the construction trade. All of these different occupations have people that are working in those occupations who have a substance use disorder. So I think it's important to make sure that we are not just singling out certain occupations, but understanding and recognizing that a recovery-friendly workplace can be any organization, any company where someone is working. I'm going to turn it over to Nikki.
So thinking about all of these individuals who may be struggling or living with, wow, I haven't even started talking yet. I'm already losing my voice. Are living with an SUD, but only 1 in 5 receive treatment. And there's a lot of different reasons of why that might be. A lot of it might be stigma and shame. People don't feel comfortable about talking about their struggles, and a lot of it and especially when it has to do with substance use, lack of access to care, and sometimes it might be knowledge of what care is available. There's a challenge of trying to find it to navigate our system sometimes, and also really depending on your location, it might also be what is available in my neighborhood. Fear of legal and employment consequences, it kind of goes back to that stigma and shame and thinking about, if I come forward, what's going to happen to my job? Am I going to be allowed to continue to work if I say I am struggling or I need help? How do I navigate that and really try to seek out help and keep my job because I need to keep, sustain my livelihood. Believe they can handle it alone. A lot of folks don't want to reach out and they want to try to internalize and keep trying on their own. But support is such a big avenue to finding help and seeking and sustaining recovery. Mental health and co-occurring disorders also play a big piece of why an individual starts using substances, and trying to address all of those pieces is an important facet to recovery. So how can RFWs remove those barriers by allowing people to feel safe in seeking support? Can we address, and build a community of support by allowing people and acknowledging the fact that there are resources are available and we're going to talk about it, and we can reduce the stigma by talking about it just generally, accessing resources, by providing a list of resources. And so people feel like, okay, if they're going to talk about it and we know what those resources are, then I can go seek help. Navigating challenges with support. Employers really have the ability and opportunity to create an environment that is very supportive, whether it's substance use disorder or some other form of, challenges that we all have when we come to work. We know we can't leave them necessarily at home. They come with us, right? So how do we build a supportive environment that can help individuals navigate whatever it is that they're going through, and addressing those co-occurring needs? So understanding that there might be additional support that might be needed. And so what is recovery? What does that look like? So if we can get folks to seek out their treatment and support, what does recovery look like? First, let's just talk about how many folks are in recovery. 31.7 million Americans aged 18 and older were in recovery from some form of substance use disorder. So how do we help them sustain that journey? And thinking about all of the different ways that a person might reach that road of recovery. And it is a unique journey for each individual. Without experience, without understanding what a person may need to go through to find recovery, we may not realize that there are a lot of different pathways available. And we do talk about that when we do some of our trainings. We try to outline that, maybe one journey would be great for one pathway, might be great for one person, but it might not be for the next person. One journey, we might go down one pathway and then say, what, that one's not really working for me. So I need to try a different pathway. And it's important for employers, for managers, for staff, and just in general, individuals to understand that there are different pathways to recovery. And we really try to help shine a light on that. Recovery from substance use disorder is a process of change through which an individual achieves improved health, wellness, and quality of life. And one of those aspects, quality of life means a lot of different things to different individuals. It might be, being able to have stable housing, food on the table, and a job can help in those aspects. And then finding that community, what communities are available that really help to sustain that recovery process. Recovery also involves addressing the underlying reasons for substance use and developing new coping skills. Depending on what type of environment you're in, what type of a workplace that you are in, there might be some underlying reasons that help to push someone towards substance use. It might be, service industries. They are very challenged with substance use. How can we change that environment so that it is more supportive for recovery? A lot of folks that work in construction, there's different things that can happen on a job site that can be very challenging for individuals. So how can we think not only about the recovery, but thinking about prevention too? So really addressing the whole big picture is a big piece that employers can do. So supporting recovery is good for companies, individuals, and the economy. So thinking about all the things that we just talked about, there's also a business case. So employees in recovery save their employers an average of $8,500 annually. And a lot of that is attributable to avoiding turnover, those replacement costs. It's hard to keep people showing up to work. But if we can build that environment where it is a good place to show up to, we can avoid those turnover costs. And if we can try to keep our people happy and healthy and showing up, that is another way to keep them on board. So it really is really trying to sustain our employees and build that environment that is a place that people want to work. The journey of recovery provides invaluable skills. So 83% of individuals reported having a having a compensated, stable job as a result of being in long-term recovery. Individuals in recovery have gone through a lot. They've had to endure many challenges. It really creates motivated workers, um, dedicated workers that build off of that journey of recovery, and they bring that into their employment setting. But also, having that job is a part of recovery. Having a stable job to show up to really is important for folks that are in recovery. And so, how can we build that environment that not only gives them that motivation to show up to work, but also brings all those invaluable skills to the table? Dedicated employees miss fewer days of work. So workers in recovery miss 13.7 fewer days each year than workers with an untreated substance use disorder, and 3.6 less days than an average employee. That's really impressive. Bringing people who are in recovery to the workforce because they want to show up to work, they know that's a stable environment, is really important. So companies that hire people in recovery and adopt these policies can be recognized as a community partner and asset to providing jobs and supporting the economy. It trickles out. It really trickles out into the community by being seen as an employer that is very supportive and a good place to work.
We've talked about what substance use disorder is, recovery, treatment, and how organizations can assist their employees. But we're now going to talk a little bit more specifically about the recovery-friendly workplace, sort of the process of becoming a recovery-friendly workplace to hopefully clear up some of those questions. So, recovery-friendly workplace is a workplace where employers and employees intentionally work together to create policies, practices, and a culture that supports employees who are in recovery from or affected by substance use disorder. It was started in New Hampshire. In 2018, the governor at the time was owning and operating a ski resort and noticed a high amount of turnover. A lot of people were just not staying on the job for long. After digging a little bit, they found that recovery supports were not there. And a lot of people who were working for that ski resort were dealing with substance use disorder and just didn't have the support that they needed to stay employed. And so instead of ignoring the problem, they addressed the problem by creating the Recovery Friendly Workplace Initiative, which we adapted here in Michigan in 2022, utilizing a SAMHSA SOAR grant through MDHHS. So I mentioned early on that MDHHS is one of our partners. They are the ones who are assisting with funding this program, as well as the entity that provides the official stamp of designation and approval. Our goal is to help businesses develop recovery-friendly workplace cultures and promote health, safety, and wellness for Michigan employers and employees. Just so you know, this is not just a Michigan thing or a New Hampshire thing. Every state on this map that is purple is currently a state that is rolling out this initiative. The initiative not only lives in each of these states, but there's a national RFW program as well, because it is noted that there's a lot of companies that go across the United States. They're not just in Michigan or not just in California. So they kind of thought it would be a great idea to have this national level RFW program. And so there's a QR code here. If you are able, you can scan it. It does have a report that provides just additional information about all of the different things going on in different states. Here in Michigan, we do have a process that we take each of our organizations through so that you can become officially designated. It does start with submitting a letter of interest on our RFW website. We will go into further detail later on before we get off this call today so that you can really understand like what that letter of interest is, how to find it. But this just acknowledges the fact that you are interested in becoming an RFW and sets off an alert for our team to contact you. After you finish the RFW or I'm sorry, not the checklist. After you finish the letter of interest, you start to go through this checklist. And in that checklist, we do offer these different trainings that you see on the screen. Training 1, 2, and 3 are what we considered required. We ask that you would have anyone on your leadership or management team to participate in these trainings. They take anywhere between an hour and an hour and a half, and we provide them virtually just like we are doing this informational session. We also have the opportunity to provide them in person if that works better for your organization. So we've done where we will come in and do like a half-day training for your entire staff. We've done like half days in the morning for like morning shift and later in the afternoon for the afternoon shift. So we pretty much can be flexible and provide you with whatever level of interaction you need. But these trainings go over more in detail about like how does SUD show up specifically in the workplace? How do you reduce stigma? You know, what types of things can you put in place to reduce stigma? We do a Narcan training. We also talk a lot about like different federal laws and state policies that impact people with a substance use disorder, as well as making sure that any like leave time, any type of policies your organization may have in place already. We spend time diving into like making sure that those policies are very clear and concise so that you are not just aligned with an RFW, but also aligned with the state and the federal laws and policies. So after you kind of complete those trainings, we do also offer, if you see the box on the bottom right, these are called Just 5 trainings and they're provided by Shatterproof. They do live on our website. Anyone can access them. They're 5-minute videos that go over all sorts of things like just stages of change, how to identify if someone's ready for treatment or support or recovery support. There's a supervisor training as well, like how to manage through working with someone who's on your team that is dealing with a substance use disorder. So I would highly recommend just freely checking those out during your free time, if you ever have free time. But they're really great educational videos. So after you sort of go through the different trainings, and I forgot to mention that we offer one of each month. So on our website, we do have a calendar and we try to keep, you know, at least a month in advance on that calendar. So you can sign up for those the same way you signed up for this, register, you get the link to Zoom. Or again, like I mentioned, you can schedule a tailored training with us. But after you complete those trainings, we do ask that, and this can be happening simultaneously as well. So as your team is going through the trainings, you can also be doing these items on the checklist. But we ask that you will ensure all of your staff receive education on your company's alcohol, tobacco, and other drug policies. So whatever those are, typically, we usually, when we, you know, first get a job, we would get this type of information during our onboarding. But sometimes those policies change, or sometimes people need a refresher to say, hey, this is our drug and alcohol policy. This is our policy of no call, no show. So making sure that your staff are up to date on those policies. Additionally, we ask that you would make sure any of your team, and this is not just the leadership team, they're going to participate in the trainings that I showed you on the previous slide. These components are for like your entire staff. So we ask that your entire staff will have some sort of education around substance misuse, behavioral health, and or addiction. Those Just 5 trainings are perfect opportunities for this. You can send them out via email, newsletter. You might even already have something that you provide. And so you can provide that as well. The next step is establishing a connection with your local recovery support organization. So we are going to dive into that a little bit deeper, but this is just an opportunity to figure out what's around you. What types of supports related to substance use disorder live in your community? And then the last item on the checklist is making sure that you've done all the things and you submit an application. The application looks very much like the checklist. It's just going to have blanks there that allow you to fill it in and say, hey, I've done this. This is when I did it. I've done this. This is when I did it. And once you submit that to us, we know you've completed the process and we get you over all of your items that come from MDHHS, like your certificate and basically your stamp of approval to say, okay, it's official. You've done the work. And I think that's it for the checklist.
So if you sign up and you kind of go through this process, we want to support you. We want to make sure that you are prepared, your staff is prepared to become a recovery-friendly workplace and really walk the walk. As Kyosha mentioned, this is a grant-funded program, so that allows us to be able to provide these trainings and this support at no cost. It's a statewide initiative, so we are partnering with organizations, and I'll dive into that a little bit deeper shortly of what that looks like. But we want to make sure that we have a partner in your area, and if not, you'll work with us. You'll get connected to substance use disorder related resources and training. So all those trainings that we just talked about. You'll receive recognition as a recovery-friendly workplace by the Michigan Department of Health and Human Services. What that looks like is you are added to our website. So we have a page of designated employers that have gone through this process who have become designated. We link to their career page if they have one. People can search by county, by industry type if they are looking for a job. We've had some folks that have gone through this program that are really looking for staff. They're looking for workers, and they recognize that there is a whole community of folks that are ready to work, that are just waiting to find the right employer. So they want to be recognized as a recovery-friendly workplace, and they have been trained to support the staff. And so we also, outside of just our website, we put you on social media. We highlight our recovery-friendly workplaces in our newsletter. And so we really want to make sure we're shining a light on those organizations who have gone through the process. You'll have continued access to one of us, whether it's us as a MPHI as your advisor or one of the recovery community organizations that you're partnered with. And we also want to make sure that you have access to Narcan. And in the training number 3, there is a Narcan training, but we can also provide training for your entire staff on Narcan. And there's also a safety box that if you would like that, you can have that at your site. That's for your own. It's not a public facing safety box for Narcan, but it is for your organization. So that can be placed in your establishment as well. So I wanted to share a couple of success stories, because it's the way that we have done it with different organizations really kind of highlights the flexibility that we try to do and we offer to our employers. So when we first started rolling this program out, we worked with Monti up in Petoskey, and they were already very much recovery friendly, but they knew that they didn't necessarily have all the tools to support their staff. Actually, 80 to 90% of their second and third shifts were all in recovery. So they knew they had an opportunity to learn more and make sure that they were supporting their staff. So what we did with them is we went up with our training team and we conducted a one-day training with their leadership staff. And then we did a follow-up training for all their super shift supervisors so that everybody was on the same page. They actually brought in a recovery coach that would come in weekly to their location and offered the trainings to or not the trainings, but that ability to be able to have a coach on site to really support their staff. And that really changed things. That really allowed their staff to understand that they were there and they were really trying to make efforts to support their teams. And they ended up hiring someone full-time to be a peer coach on their staff. There's a lot, they gained a lot of access and or awareness because of all of their efforts. Before the current administration, they had a roundtable and they brought a lot of leadership staff from a lot of large organizations to talk about what it is to be recovery friendly and how to really dive into supporting their staff and what challenges they were facing. So they were brought in to attend that event as well. We also worked with Henry Ford Health St. John's. They were our first hospital to go through this training. We had an internal champion who really developed their internal task force. That is so important to have someone leading this within your organization. That makes all the difference in how it rolls out. So they were able to bring in the correct partners when we were talking about how do we address policy. So they brought in HR and they brought in their EAP, and we all met several times to customize a presentation for them. And what that looked like is we took our training 2 and 3 and we added their policies and their procedures, their resources, their benefits into those trainings. So when we were training their staff, everyone was learning, how do we do it here? How do we really build this here within our organization? We offered hybrid and virtual trainings for them. We did 2 for each one of the trainings, of the 3 trainings, so that there were multiple opportunities for their staff to attend. And in addition to that training, we also brought in Health Professional Recovery Program, HPRP, which really is important for those licensed professionals. So that was an extra training that we built in for them. And it made a huge difference because then again, we're starting to reduce stigma. We're talking about the resources that are available. We're making sure people are connected to what that can look like. And then I just put a couple of the survey feedbacks. We do request evaluations after all of our trainings. That's another piece of the process, if you will, is we want to make sure the staff is completing their evaluations. But we took some takeaways from them and we just wanted to highlight them here. One of them was learning about the person-centered language and how to reduce stigma, along with how to support employees with substance use disorder. That was very important to them. They also identified as workforce as a #1 support for those in return to use or recovery. And we asked a couple of thoughts on next steps, and they discussed talking about resources with their staff so they know how their organization supports them, and hiring those who are working through these programs that offer extended opportunities. The final example I'm going to share here is Mission Restaurant Group. They have a lot of very popular, probably recognize some of the names on here, locations around the state. So for them, we did everything virtually because we recognize the fact that not everyone's going to be able to come together in person. And so we offered personalized virtual trainings, 2 of each training, so that the different shifts could attend those trainings. We also really identified that while they had Narcan on site, and we asked the question, does everyone on your team know how to use it? Across the board, the answer was no. And so we really determined that that was an important piece to go into each one of these locations and provide Narcan training for all staff. And we offer Narcan virtually. We work with Face Addiction Now. They provide our Narcan training and have done a number of virtual classes. So if we have additional staff that need to attend at a different time, we can do that. But we also send people to do the trainings in person. And that's what we did with Mission Restaurant Group. So this is an example. This is, a number of our recovery-friendly workplaces who have gone through the program. We put their logos on this page. We currently have 60 employers who have gone through this and are designated as recovery-friendly workplace. This is constantly growing. And so I know that we don't have everyone on here yet, but we keep adding and the logos are getting smaller and smaller. So go to our website and you can see a full list there of all of the recovery-friendly workplaces. So we just wanted to walk through how to get started. We didn't want to leave this, opportunity to meet with all of you without a few next steps. And it's very easy to get started. As we mentioned, we are partnering with a lot of recovery community organizations around the state. And it's really important to connect with one that's in your area if there is one that is one of our partners. On our website, you can visit our the recovery friendly advisors and see if there is one in your community. If you recognize your shape on this map, or you can also see that we have a list of our recovery friendly advisors on our website that shows which county they're in. And it would be great to identify who that is early on. If you don't do this and you fill out your letter of interest form, we see that you are located in one of these partner counties, we will connect you, because we really feel that it's very important that you know who is in your backyard and who is available to your location. And so these are all of our current partners in the area. Like I said, if there is not one there, then we are your advisor at MPHI, and we will work with you to make sure that you get trained. The next step would be to complete the letter of interest form. And so that is found on our website. Also, it says become a recovery friendly advisor. You can see a little circle there. It's kind of small, but when you visit our website, you'll see where to select the become a RFW. And it will take you to this page which says get started, letter of interest form. And you'll click on that form, and then it will open up a survey that asks your information. So you fill out your name of your organization, the industry that you are a part of, and also list the number of workplace locations. We just try to find out a little bit about you so that we know what we might need to do to start to help you go through the process. And so if I see, for an example, an organization that has, 5 locations, 20 individuals in each locations or more, or we've had people, they've got 1,000 employees, we know that there's going to need to be some tailored trainings to really help them get through the process. If it's a smaller organization and you have like 5 or 10 employees, virtually might be great for you. It might be you might have, 3 leadership staff that you see that need to go through the training. And virtually visiting our website and finding those training dates might be the best step forward for you. So there's multiple opportunities. If you're working with an advisor, they can also come to you. So they do in-person trainings all the time. They offer boot camps where they're doing everything in a half-day session, and a lot of organizations are coming together. There's a lot of opportunity. So not to overwhelm you on all of that, but that's why it's important for us to see who you are and your number of employees and all your information there. Now, if you've determined that there is a advisor in your area, this might be the opportunity to select them. If you don't select them, and like I said, I see that you're in one of these communities, I'll connect you. But we're asking you, how did you find out about us? And you might have met or one of our RFWs, one of our advisors, and you can share how you've learned about our organization here. After that, we'll start the process. So you'll receive an email from either us or one of your advisors. And you just want to start thinking, who needs to be trained? Who are those leadership staff that are at your location that really have the ability to make change? Do we need to have HR? Do we need to get them connected? So start thinking through that process and let us know if you have any questions. Our email is listed here. And I also have on this page, you can also sign up for our newsletters. We're constantly trying to add more opportunities to dive deeper into some of these different challenges or policies or resources that are available. We just hosted a webinar on recovery community organizations and peer recovery coaches and what services they offer and how they can partner with employers. And so we're always trying to build on what we're doing here to be more helpful for our employers. So that was a lot of information. Does anybody have any questions? I'd love to open the floor to your questions, and if you have any thing that's burning to ask right now. Any questions? I'm not sure if you are trying to talk, you're muted. Paula, if you are trying to ask a question, you're currently on mute. In the bottom left of your screen, I think there should be an audio button.
Mute.
There you
Oh,
go.
okay. All right. Yes, we have somebody on our staff, our board, who has already applied, and I believe
Probably completed.
is, yeah, I think has completed the certification. Do each one of us individually need to do that?
So are you a leadership in the leadership staff for that
Yes,
organization? Then
yes.
yes, your
Okay,
team of leaders should go through the training.
okay. Right. Well, that's why we're on the informational meeting today.
Awesome.
So
Which organization are you with? Let's
we
see.
are with Vineyard Village,
Okay.
DBA Fresh Start Coffee House.
Oh, okay, great. Wonderful. Bradley, right?
Yes,
Yeah,
Brad.
okay.
Yes,
Yep.
indeed.
Wonderful.
And we have
Well,
a recovery coach who also will be joining. I think, I think you've got other meetings, right? Isn't there one tomorrow?
yes, tomorrow's orientation is very similar to today's information, slightly different, but if you have gone through this, I think you could probably jump into training number two or
Number
training number
two.
one, I should say, and one, two, or three. And you don't need to take them in order, so keep that in mind.
I
If
see.
scheduling wise,
Yes.
if that works easier for you, can jump around. We have trainings listed on our website through July, and we'll be adding August and September shortly.
Okay, wonderful.
Yeah.
So that will work for us.
Wonderful.
We essentially only have two employees, and that's not my husband and I run this. It's a nonprofit, and it's specifically to work with to give employment to people facing reentry as well as recovery.
No, actually, we have two positions plus a staff
Right.
person.
That
And so we have up to 4 or 5 at times. So, um, and most of the board is trying to get through this. So,
That's wonderful. That's great. Let us know if you have any questions as you go through it. Would love your feedback as well. So feel free to let us know how things are going. And I love that you're doing that. I know Brad had mentioned, I love the name Fresh Start Coffee House
Mhm.
and what that means. So thank you all for taking the time to go through this.
sure.
Let's see, Andrea, I see you have a question.
Yeah, I know you had mentioned Montai out of Petoskey and them already having a good recovery-friendly workplace.
Mhm.
Coming from a organization whose main purpose is supporting those in recovery, how would we maximize the value of becoming a recovery-friendly workplace ourselves? Does that make sense?
So could you go a little bit deeper, maybe, and share a little bit more of what, when you say maximize, are you looking for employees? Are you looking for,
Yeah, so like we aren't at the place where we are hiring
okay,
staff right now. We're all volunteer based. Um, and we offer peer recovery coaching and resource connection and case management for people in our community. So I guess my question is, how would we benefit from becoming a recovery friendly workplace?
I think as one of the things that I really like to make sure that people understand that I know are very recovery friendly and could probably do training number one in many cases if they are working for an organization that provides a lot of these services. But I think that the thing that in training number two that talks about policies, that talks about the laws, all of those things that go a little bit deeper into what it means to be recovery friendly as a business is really important. And so for those organizations that are kind of like, well, why I know I'm recovery friendly already, why would it help me to do that? That's a big piece, is really understanding the nuts and bolts of how you do that in a business sense. In addition, some of the things about being shared as a recovery friendly workplace, really exploring how to say that we have gone through this journey, we are recovery friendly, and being shared as one of those organizations who is that is for many organizations is really important. And as a community, as we're all trying to build this initiative across the state, and being able to say all of these organizations have gone through the steps to become recovery friendly and are recovery friendly and are doing this for the community, doing this for their employees, it's a statement, right? It's a statement to say that you are a part of that process.
Awesome. Thank you.
Does that answer your question?
It does.
Okay. Thank you for that. Let's see. John left. I'm not sure if you had a question there. Any other questions?
I just want you to repeat what you told me because one of our other staff members has just joined and she's muted. She's watching her little grandbaby who's not quiet.
No
So if
worries.
you could just reiterate what you said about if we've attended this informational meeting, we probably don't need the first training and can just go straight to the second.
Actually, the orientation. I would love it if you'd go,
Orientation.
yeah, you can skip the orientation if you've been through this whole one, but if your employee has or if your staff member who just joined, if they were not here for this entire presentation, they should probably go to the
Okay,
orientation. That kind of helps to give the big picture, and then go through training 1 through 3.
right. Okay, great. Want to make sure we're all on the same page. For some reason, we don't always hear the same.
I hear you
That
100%.
was me. Yeah. Too much in the brain.
Yep, I get it. I totally get it. Sometimes it also takes just rephrasing it in a different way for it to click in my brain.
Thank you.
Yes, hello.
Hi.
Oh,
Hi. Yeah, I am the staff that Paula was speaking of. I have attended a few um, trainings in April.
Okay.
I think I missed the first one, which was the orientation. Uh, I, so, but I think I'll be just going over all of them since we're all participating at the same time. I think it would be helpful.
Okay. That is not a problem. And just, if you have new staff that join, even if you're already designated, feel free to send them to join. We've had other staff do that, as our organizations do that as well. If you want to see something again, if you feel like, a refresher is needed, if you have new staff that join, they're welcome anytime to any of those trainings.
very good. Thank you.
You're welcome. All right. Well, if anyone has any questions and need further discussion, we are happy to meet separately. Feel free to email us, and we can reach out and talk further. Otherwise, it sounds like we'll see you at future trainings, and we look forward to it.
And tomorrow is the orientation. Is that
Correct.
correct? Okay. All right.
Yep.
Good. So we won't see you then.
Okay.
Thank you so much.
You're welcome. Thank you. Take care, everyone.